Wonderful. I think it might be time now for us to begin. And out of respect to everybody who was here on time and early and waiting, let's get going. Now, my name is Kelly Dunn, CEO of Women's Health Loddon Mallee, and it is my greatest pleasure to welcome you all to the launch of a project that we're so proud of, Her Mental Health Matters, because mental health matters so much. Before we begin, I'd like to introduce our Auslan interpreters, Georgia Knight and Erin Drummond, and remind the audience that Zoom has a closed captions option if you need it. You can turn this on by going to the control bar and clicking the show captions icon. Now, on behalf of Women's Health Loddon Mallee, I would like to begin by acknowledging the traditional custodians of the lands on which we live, work and play. We celebrate and respect the unique cultural and spiritual relationship that Aboriginal and Torres Strait Islander peoples share with the lands, sky, and waters, and the ongoing contribution their cultures make to the life of the region. Now, as we pay our respects to elders past, present, and future, we pledge our organisational commitment towards reconciliation and justice. We recognise the strength and resilience of all Aboriginal and Torres Strait Islander peoples and are dedicated to a future in which they feel connected, empowered and safe within the communities of the Loddon Mallee and beyond. Now, Women's Health Loddon Mallee have a vision. There's two parts to this vision. And the first part is that women, girls and gender diverse people in the Loddon Mallee region are empowered to stay well and protect their mental health throughout their lives. The second part to this is that we would love for diverse voices and experiences to be valued and amplified, and that meaningful connections are supported, creating a community where everyone has the social, economic and environmental conditions that they need to thrive. Now, to achieve this vision, we have developed the Her Mental Health Matters strategy, a comprehensive roadmap that will guide our health promotion efforts over the next 3 years. Her Mental Health Matters closely aligns with the Victorian Government's recently released Wellbeing strategy, recognising that communities experience health and wellbeing challenges differently, and our regional strategy focuses on the local needs of women, girls and gender diverse people across Loddon Mallee. By taking a targeted upstream health promotion approach, we can gain a better understanding of the challenges and opportunities in the region. And this enables us to address issues before they occur and helps everyone achieve improved health and wellbeing outcomes. Now, evidence shows that rural and regional women, girls and gender diverse people face distinct barriers and challenges when it comes to mental health and wellbeing. So issues such as gender inequity, gender-based violence and intersecting forms of discrimination have a significant impact on mental health outcomes. Many individuals in our communities are balancing work, household responsibilities, caring for others, as well as facilitating social connections and ensuring the well-being of others. Now, these responsibilities are often shaped by gendered expectations and often mean that women place their own mental health and wellbeing needs last. Throughout different stages of life, women faced an increased risk of loneliness, isolation, and homelessness. For those living in rural and regional areas, these pressures are intensified by limited access to services, geographic isolation, and fewer opportunities for community connection and support. Now, despite these challenges, we fully believe that by working together, we can challenge societal norms, strengthen community connections, and advocate for gender-responsive access to supports and services, ensuring that help is available when and where it is needed. Now, I am confident that Her Mental Health Matters will be useful to you in your role as we collectively work to improve mental health outcomes of regional women, girls and gender diverse folk through evidence-informed, place-based and gender transformative approaches. Women's Health Loddon Mallee very proudly engaged Lauren Zappa as our consultant to support the design of this strategy. Lauren partners with impact-driven organisations like ours to create strategies and programs that are equity-focused, community-led and tackle the underlying determinants of health and wellbeing. Now, I'd like to thank Lauren, the whole Women's Health Loddon Mallee team, all of our panel guest speakers here today, and everyone who contributed their experiences and ideas to inform this strategy. Now, that's enough from me, and I'll hand over to Lauren, who'll share with you further details about the development process leading up to this launch. Thank you for being here.
Hello, everyone. I am Lauren. I'm just going to get my screen going so I can tell you a little bit about how we went about developing this strategy, Her Mental Health Matters. So I'm going to kind of outline the process, and I really want to show you some of the insights that came out of our engagement process. It was really important, as Kelly has said in her intro, it was really important that this strategy was centred in the lived and living experiences of women, girls and gender diverse people from across the region. But we also really were keen to ensure that the wisdom and perspectives from stakeholders across the region, in particular those who had shared or aligned visions for the community wellbeing, were also embedded in the strategy. So we commenced with a situational analysis, and this included a policy and a literature review, an internal analysis of the organisation's strengths, limitations, priorities and opportunities, and a stakeholder analysis where we aim to identify and prioritise stakeholders that we wanted to engage with. Now, I am going to run through the engagement strategies that we used shortly, but all of the insights from across both our engagement and this situational analysis basically formed the foundations of the strategy's vision, the priorities, and the actions. So the first strategy that we used was that we sought to identify which of the stakeholders we thought would have a high interest in the development of Her Mental Health Matters, but also a high impact on the strategy's success. And then we invited these stakeholders to be part of a working group. And this working group really helped design the strategy at multiple touch points, including participating in a strategic planning workshop. And we had so much amazing insights come out of this workshop. And I really tried to just condense it into kind of 4 key insights that you can see on the screen. Firstly, the group really identified that there was a need for really good quality evidence to inform regional planning and decision making. This includes both better collection of sex and gender disaggregated data, but also meaningful and inclusive research, consultation and co-design to really make sure that we were able to capture and amplify diverse voices from across the community. The group also felt that there was a real need for upstream approaches that address the structural and social determinants of mental health and wellbeing. And that mental health was really embedded into kind of those everyday community settings. We know that there is a need to advocate for rural needs when it comes to mental health service access and quality, but the group also felt that it was important that Women's Health Loddon Mallee played a really important role at that intersection of rurality and gender, and that this would be really critical for this advocacy is really critical in terms of the system reforms that are happening as well. And finally, the group felt that Women's Health Loddon Mallee already plays a really important role in building capacity regarding intersectional gender equity, and that if we're going to see improvements for mental health and wellbeing for women, girls and gender diverse people in the region, that this was going to be really important to ensure that policymakers, planners and service designers can really build their knowledge, skills and confidence to assess and address the gendered impacts of their decisions on the community's wellbeing. So we used a community survey to engage perspectives from women, girls and gender diverse people from across the region. And we heard from 53 different community members across 22 postcodes. We had an average response time of about 18 minutes. So just really shows you the kind of the richness of the responses that we received. Have a bit of a read through some of these quotes, and what I'm going to do is just highlight some of the emerging themes that came out of these responses. So firstly, we heard a real range of experiences about that really show how important interpersonal relationships and social connections are. They can both promote and undermine wellbeing. So we heard some really beautiful examples of friendships, supportive intimate partner relationships, and even just the impact of, a smile or a hello when you're out in public, and how that can impact on people's wellbeing in a positive way. Conversely, we heard about experiences of family violence, interpersonal conflict, and social isolation as things that challenged people's wellbeing. We heard about the value of community places and spaces in promoting social connection. So people talked about neighbourhood houses, libraries, dog parks, gardens, bush tracks as really important local assets that really help support their wellbeing and connection. We also heard that volunteering, being part of a club or being part of a committee, helped people feel a sense of purpose and a sense of belonging in their community. However, for some, when out in public, they experience a lack of respect, a lack of safety, or a lack of inclusion. And this left some people in some of our respondents feeling isolated, excluded, or even unsafe in public spaces. We heard quite a bit about experiences of financial stress. So we heard about experiences of housing insecurity, the rising cost of living, lack of workplace gender equity, and how all of this really creates chronic stress that impacts on people's mental health and wellbeing. We heard people kind of talking about the mental load of balancing caregiving, managing a household, work, and other kind of life commitments. This seemed to place an enormous strain and was really a barrier for practicing self-care or for help seeking as well. People just didn't feel like they had the time to look after themselves. Some people also talked about the challenges of mental health access and quality. We heard some of the kind of rural challenges that you would be aware of, long distances, cost, lack of privacy. People also spoke about the difficulty in navigating what was seen to be a complex service system. And we also heard some people having experiences where they didn't feel that mental health services were safe or respectful or gender responsive. Some people spoke about existing health conditions and how that can impact on their mental health. So some people spoke about experiences through menopause, experiences with chronic conditions, with disabilities, neurodiversity, and how this could either add to or compound their existing mental health challenges. And finally, I'll just turn your attention to this quote in the very top corner, because I think this really, in one quote, really articulated what so many people were saying, just the impact of kind of broader social issues and how that adds an extra weight. So this person said, global issues, including the impact of Trump, the rise of the far right, climate crises, and the genocide in Gaza, have been a huge impact on my mental health over the last year or so. More locally, I feel we're seeing an increase in climate emergencies, racism, homophobia, transphobia, and hatred that is in part due to these more global issues. COVID-19 and an increasing reliance on online spaces have also had a hugely negative impact on community connectedness. That was a really powerful quote, I thought. And then our final strategy was that we knew that there were some gaps in our knowledge. So we wanted to engage with stakeholders from organisations across the region to help us really kind of deepen our understanding or get a more nuanced understanding of the community's needs and experiences. So we spoke with representatives from Aboriginal cooperatives, youth mental health services, community health and tertiary education settings. Again, there's some more quotes from them on the screen. What we really heard was a lot more about gender bias in the health system, experiences where women felt dismissed, not believed or misdiagnosed with regards to their health and wellbeing. We also heard about that intersection of gender bias with other forms of discrimination and systems of oppression like colonialism, racism, ableism, homophobia, ageism, and how this creates a compounding effect, which not only impacts mental health, but it also impacts feelings of belonging and people's ability to seek help. On the flip side, we also heard about the practical challenges in embedding system reforms and improving access and quality to mental health care. So we heard about workforce and resourcing constraints that make it really difficult for rural health organisations to keep up with reforms. So we know that some organisations are impacted by reforms across health and disability and aged care. What I was hearing was that while there's a really a desire to create more quality and inclusive services, there is a real balance there in managing the kind of lack of resources, and it can end up feeling compliance focused. We heard more about the balancing of life demands in particular for mums and family responsibilities. One thing that was really interesting that came up in a couple of the interviews was how parenthood can be a key time where unresolved traumas or intergenerational trauma can really start to emerge. As you know, raising young people and being confronted perhaps with things from their younger years that have been kind of pushed down. We also heard about the impacts of violence and relationship breakdown. So some of those immediate impacts: trauma, stress, increased caregiving responsibilities, financial and housing instability. But we also heard about the long-term impacts of relationship breakdown and family violence, and how this can really impact women well into their older years, resulting in poverty and homelessness. And in fact, we heard some really harrowing examples of women who are not able to afford basic needs such as menstrual or continence products, and really feeling like their dignity has been compromised. We also heard some issues facing young women, such as eco-anxiety, eating disorders, self-harm, loneliness, suicidality, and in particular concerns for young people who are living with disabilities or are part of the LGBTQIA plus community, feeling particularly isolated, and that isolation kind of increasing with increasing rurality. And we heard a little bit more about the complex impacts of climate change on wellbeing. So not just the direct impacts of disasters, but also the indirect impacts, such as that kind of the intersection of housing quality and rising energy costs, and how climate change is really going to impact those who are already more disadvantaged, economically disadvantaged, and certain groups will feel that more. So a huge dump of information, so many insights. I'm going to now throw over to Alison from Women's Health Loddon Mallee, who's going to dive into how all of these insights really made its way into the strategies, priorities and actions. Thanks.
Thank you, Lauren. I'm just going to share my screen as well. Here we are. Great. Thank you so much, Lauren, for all of your work in bringing this strategy to life with us. It's really exciting to see it develop and to be here launching it today. As you have given a wonderful summary of some of the voices that contributed towards this strategy, and the gendered violence, leadership inequity, and the traditional gender expectations that all get in the way when it comes to caring for our mental health and wellbeing, and that living regionally makes it much harder to access services and supports. As Kelly stated in her welcome, our vision for this strategy is to empower women, girls, gender diverse people to stay well, protecting their wellbeing across the life course. To do this, we've identified 5 key priority areas for action, and they're designed to guide anyone, whether you're planning programs, shaping policy, or if you're simply wanting to understand what influences women's mental health with a really strong foundation. And we've given some clear examples of lots of ideas, some of which are easy to implement, some quick wins there, alongside strategic actions for longer-term societal change. Her Mental Health Matters is not just a strategy for Women's Health Loddon Mallee to follow, it is a call to action, and it reminds us that improving mental health requires a collective effort, and one that is responsive to what women want and need, and we're excited to build on it together with you. Our first strategic priority is around enhancing local evidence. We have 10 local government areas in the Loddon Mallee, and they are all different, and we need to understand them better if we're going to serve them better. Without inclusive, locally grounded evidence, we're missing the full picture of what's happening and what's needed. And we need to increase the collection, availability, and use of sex and gender disaggregated data. But we also need women and gender diverse people to share their lived experiences, to bring those stats and facts to life. We're not numbers, and we need women, trans and gender diverse folks to take up leadership roles so they can shape those policies and programs. In late 2025, Women's Health Loddon Mallee will begin a project focused on mental health, gender and housing as a social determinant of health. We're going to create safe spaces for people to share their experiences and explore the mental health impacts of housing affordability, safety, security, availability and accessibility. We know that by collecting and amplifying regional voices, we can make sure that all gendered experiences are represented and build a stronger evidence base that supports meaningful change. Our second strategic priority is around strengthening community connections. In much of the evidence that informs the strategy, we heard that regional life can be really lonely and that there might be opportunities for connection, but people don't always know about them or feel welcome to attend. In health promotion, our goal is to protect and enhance wellbeing and that upstream approach to keeping people well. And one of the most powerful ways we can do this within our communities is by creating and supporting opportunities for people to come together and connect. There are some really wonderful opportunities for connection being provided throughout our region. Neighbourhood houses, local government initiatives, and some brilliant example of peer-led activities within communities. These are dance groups, exercise classes, community choirs, and it's been really exciting to see the development of social prescription programs, which are helping people find those pathways to connection. But we need to do more. And what we can do in this space is implement and support mental health promotion initiatives that highlight the importance of community connection and highlight the importance of people coming together to stay mentally well and to bring people together in those spaces and normalise mental health conversations within those spaces to reduce stigma. At Women's Health Loddon Mallee, we are not the experts in every space, and we're committed to building partnerships, particularly with First Nations, multicultural and LGBTQI+ communities, to ensure our work reflects the diverse needs of our region. And a great example of this is our Aunties on Country program, which has been running since the floods just post-floods in 2022. We've been working alongside First Nations women to deliver weekend gatherings that foster cultural connection, knowledge sharing and healing. And our next gathering is planned for October, and it's been such a privilege to work alongside these wonderful women in this work. And it's a great model if anybody's interested in what we've been doing to be able to share with you. That takes me into our third priority, which is addressing barriers to support. There's nothing more frustrating than needing to get help and not knowing where to go. And imagine facing that challenge without English as a first language, or not feeling safe to access services because of your gender identity or who you choose to love. Access to mental health support needs to be simple. It needs to be safe and inclusive. Yet for many women, girls, and gender diverse people, it's not. To make this happen, we need plain language service navigation tools that reflect diverse needs. We need inclusive and culturally safe and gender responsive services. Our LGBTIQA+ communities are already impacted by being in a minority as well as by their rurality. So let's make sure they've got welcoming doors and inclusive services that support them. I'm especially excited that Mind are here, Mind Australia, that are going to be presenting later in this session about their work in the mental health locals, which is a great example of inclusive service navigation in action. And as part of addressing barriers, we also need organisations to embed gender equity into their policies and practices. At Women's Health Loddon Mallee, we are actively supporting organisations to complete gender impact assessments, which are GIAs. GIAs can be done on policies, programs and services, and they bring a gender equity lens, helping to remove barriers and help people think about the things they haven't thought of yet and improve the mental health of their workforce by building more equitable systems. And if you need support with the GIA, please do reach out to us. Our fourth strategic priority is in empowering individuals to protect and improve their wellbeing. We all experience mental health differently across our life stages, and we need knowledge, skills, and confidence to actively protect and improve our mental health and wellbeing at each of these stages. Collectively, all of us here today can develop practical resources that explore the links between gendered experiences and mental health, sharing education resources like the chore audit that help identify unequal divisions of caregiving and family responsibilities that impact women's wellbeing at home. We can also work with specific groups of people to build their understanding of the links between physical and mental health and deliver content that's culturally safe and in appropriate ways. At Women's Health Loddon Mallee, we deliver Let's Talk Mental Health. These are short information sessions that we run across the region that bring accessible community-based education to where it's needed. I think it's really important to note that we have 5 other priority areas at Women's Health Loddon Mallee. Mental health intersects with all of them. So when we speak about mental health literacy, we have to make sure that people understand how poor sexual and reproductive health, family violence, and the gender pay gap impacts their mental health, because empowerment is prevention. And when people understand how their gender roles and reproductive health and economic inequity affects their mental health, they're better equipped to take action, seek support, and advocate for themselves. Our 5th strategic priority is embedding mental health in community settings. There's a whole lot of community environments that we live and work in within our communities, both online and face-to-face. But I think more than ever now, we're in so many spaces where we see sexism, racism, and derogatory commentary, both in person and online, that is creating very unsafe spaces for us. We can continue to activate change in this area by embedding gender-responsive mental health resources and initiatives into our community settings. Libraries, schools, and neighbourhood houses who can partner with us to deliver sessions on things like gender equity, to break down traditional stereotypes and assumptions. And it's been wonderful to see how much work is happening in this space across the region. There's a recent example of this is our active bystander training for young people, equipping young people with the tools to challenge safely gender-based violence when they encounter it. And we're also working to raise awareness of the gendered mental health impacts of climate change, emergencies, and disasters. One way that we're going to be doing this looking ahead is developing an advocacy piece on drought. This is a 2-year project with the goal to build evidence on how drought impacts women's mental health and wellbeing across the Loddon Mallee region, and support organisations within the Loddon Mallee to respond. So, in summary, we're going to enhance local evidence to build a stronger, more inclusive evidence base. We're going to strengthen community connections to create opportunities for connection and belonging. And we're going to address barriers to support, make it easier to find and access inclusive, gender-responsive mental health services. We're going to empower women to protect and improve their wellbeing, equipping them with knowledge, skills, and confidence, and embed mental health in community settings, integrating mental health initiatives into everyday environments. I'm excited for us at Women's Health Loddon Mallee that we're already well on the way to activating this strategy, and certainly not starting from scratch. And I'm certainly looking forward to working with you here today to deliver this strategy over the next few years. I'm going to stop sharing now, because now you have heard a bit more of the strategy itself. I'm going to introduce our guests who've joined us today. They've each got a short presentation that will explore practical examples of activating our priorities, and are going to share their insights and expertise on what's working. Following their presentations, our guests will join us for a Q&A, and we opened questions in the registration, so hopefully you'll hear some of your questions responded to. Our first speaker is Sarah Hearn. Sarah is a self-proclaimed recovering academic with a background in medical and cultural anthropology. She has spent 3 years as the lead mental health wellbeing promotion officer at the Loddon Mallee PHU, the Public Health Unit. And Sarah's going to take us on a bit of a deep dive into priorities 1 and 5, enhancing local evidence and embedding mental health in community settings. I shall hand over to you, Sarah.
Thanks, Alison. I'll just share my screen. Okay. Hi, everyone. I'm Sarah. As Alison introduced me, I'm from the Wellbeing team at the Loddon Mallee Public Health Unit. I'd like to echo the acknowledgements of country that's been shared, and add that I'm on Dja Dja Wurrung country. I pay my respects to elders past and present, and I acknowledge that sovereignty has never been ceded. I also acknowledge the individual and collective contributions of those people with lived and living experience of mental ill health, trauma and suicide, and their families, kin, friends and carers. Finally, I want to welcome everyone regardless of ethnicity, faith, sexual orientation and gender identity. So if you haven't come across the LMPHU yet, our role and core values is to be working across capacity building, collaboration and communication. So we deliver a place-based model across a whole section of the Loddon Mallee region, which I'll show you later. We have population health plans that we deliver. We sit at quite a high strategic level of prevention-focused health promotion. In guiding our work, this is the very recently released Wellbeing strategy for Victoria. This is sort of something that we work across, but also a lot of other people do as well. So it might be familiar to you. In terms of what we've been hearing in our region, everything that we've been hearing echoes the same issues that Lauren spoke to in her presentation. So this is things we've been hearing from Mildura all the way down to Macedon Ranges. Issues like the social determinants of health, difficulties accessing systems, mental health literacy, priority populations experiencing difficulties, and particularly young people as a critical target group for prevention. So our region, I sit in the Loddon region, but we have my team that sits across the Murray and the Mallee as well. And in our consultations across each of these regions, you can see on this slide the issues that have come up, and they're all slightly different as each of these communities has different difficulties and different stories that they're speaking to. So just a little snapshot. These are some of the mental wellbeing networks that we chair or we facilitate or we sit on. And this is where we hear stories and concerns from the community. Women's Health Loddon Mallee also partners in many of these networks as well. So you can see that there's a lot of communication and connection across the region. To support the stories and the advocacy of our region, we've produced data profiles that are available and can also provide data profiles for townships upon request. As you can see, there's one for Heathcote. We've also got a video to assist with finding data on the new Victorian Population Health Survey dashboard, which can be a little bit tricky. So I've popped a link into that in case you might be interested. Thanks to our partnership with Women's Health Loddon Mallee, each local government area profile is now being updated to include the Women's Health Loddon Mallee data snapshot and link to all of the services and resources at Women's Health for those areas. Another way that we're enhancing local evidence is through our project, the Social Inclusion Measurement Project. This is available for pretty much anybody who's running projects for the community. It's a way to share data amongst a larger population of organisations and to measure the social inclusion that people are experiencing in our region. And it's really exciting. So I've put a link into that at the end as well. On embedding mental wellbeing in community settings, we want to acknowledge that in our regions, there are so many different community engagements that are happening already. There's peer groups such as men's fishing groups in Echuca. The Different Journeys Autism runs men's, women's and youth peer groups every month for people experiencing autism and ADHD. There's women's sheds in Castlemaine. There's the Swan Hill Community Health Department that has a women's clinic that provides holistic healthcare for women. So there is a lot of things already happening that we're really excited to partner with and support. there's some extra little non-gender specific grassroots mental wellbeing programs that we're part of or that we support here. So, and you can see that these stretch from the top of Mildura all the way down to Macedon Ranges. We also are connecting with our priority groups. So Alison spoke to social prescribing, and we have multiple partners and stakeholders that we're supporting with that. We also run multiple LGBT connection groups and networks. So the Rainbow Coalition in Bendigo is one of those. We're really looking to support the lived experience voices, particularly of the CALM, disability, neurodivergent, LGBT, and carer communities, because that's a major component of the Victorian Wellbeing Strategy. And Libby will share with you a lot about the lived experience side of things too. Also in our community settings, there's a whole bunch of amazing mental wellbeing events that happen across the regions, across the year, such as the different Pride in the park in Castlemaine, for example, as well as Bendigo. There's Wear It Purple events at schools. And we recognise that these are being orchestrated by communities, by organisations, by schools. And we thank everybody for the opportunities that we've had to support the amazing work that you do. Another way to respond place-based to mental wellbeing has been to provide keeping mentally well literacy resources across our regions. So we've created these for each of the local government areas across our catchment, and we're continuing to update them to be responsive and direct people to the closest available care for them. And that's pretty much all from me. Our strength, as always, has been in collaboration. And I think that that's something that Women's Health Loddon Mallee does really well. And in being place-based and joining forces, we can actually make a huge amount of change. So yeah, scan the code if you want to see a little bit more about the Social Inclusion Project. And I just want to thank Alison for the opportunity to share.
Thanks so much, Sarah. Great presentation, and I'm really looking forward to working with you and sharing some of those things that are happening across the region. I always feel very privileged to live on this beautiful Jarrah country with some of the amazing things that happen here. Our next speaker is Liz Wright. Liz is from Women with Disabilities Victoria, and Liz has a long history of working as an advocate and activist. This includes her Disabilities Victoria podcast series, From the Outskirts, which features 12 interviews with regional women with disability. Her podcasts are well worth checking out, and the link is in the chat, but please don't listen to them yet, because Liz and I are going to have a bit of a chat first. Hi, Liz, how are you going?
Yeah, really well. Thank you, Alison. Thank you so much for giving me the opportunity to have a discussion with you and to talk about this incredibly important topic. So thank you.
Thanks, Liz. It's great to have you here. Liz, let's start perhaps with what does mental wellbeing mean for you, and how do you think intersecting identities like gender and disability impact mental health and wellbeing outcomes for women?
Look, mental wellbeing is, for me, a key part of it is connection, and a key part of it is being able to be visible with your mental wellbeing and be visible when your mental wellbeing is not so great too, so that there is an open conversation that can occur between myself and other people around and other organisations around what you can do to actually work on those things that are impacting your life. And it's been mentioned by yourself and by Sarah, but there's parenthood, there's ageism, ableism, lots of things that get in the way of mental wellbeing. So being in an environment connected with other people where there can be frank and open conversation, discussion, sharing of resources is really important to me as someone who works at Women with Disabilities Victoria, but also as somebody that works in a collaborative way across other organisations as well. Mental wellbeing is really about total inclusion and having equal rights and the equity that everybody else has.
Thanks, Liz. That open conversations really sings a lot to me in terms of when we're talking about reducing stigma as well, in terms of people being able to share where they're at, where they're at when they're at it. So to be able to support people to access support and help.
So just before we move on to the next little
go on,
bit,
please.
I just wanted to say I could give an example. At Women with Disabilities Victoria, we have probably over 90% of our staff have disability in some sense, including psychosocial. We have people with ABIs and different things going on. So in our team, what we do is we work towards understanding when somebody needs to reallocate tasks to somebody else because they need a bit of a break. And we have these conversations that occur in the workplace, but also there has to be an element of trust that's built up within the team. We can only do that by being honest and frank and by being helpful and resourceful to each other. So I just wanted to add that in because there will be generalist comments that come out that are around leadership or respect or equity, but unless we have examples of how they could actually work, it's hard to imagine.
I think that's a really great example, and thank you for sharing it with us. I think we can all take that on. That's a really good way of thinking about things. Well, you've got lots of wisdom to share. We've got a wonderful audience today with us from across the sector, and our second priority area is around strengthening community connections. Liz, I know that you're particularly interested in a holistic approach to inclusion, and you spoke a little bit about that in your opening, but would you like to speak a bit to that a little bit more?
Yeah, look, one of the things, my role is I'm the Manager of Community Inclusion and Women's Empowerment, and our emphasis is really around inclusion of women, and the emphasis is on rural and regional women and gender diverse people. We know that services are not always available. We know services are not always affordable. We know that sometimes you feel like, the only person in the village, and we work very hard to connect people. So we have 4 regional hubs. We're about to launch an online hub that will be Victoria-wide, and that will be an after-hours hub where people can get together. The hubs work in several ways, and that is we want to support women and gender diverse people on their journey towards being their best selves. And by that, we support people, we provide resources and opportunities. And WDV has a really great history of employing people who have come through our programs as well. I think the rural and regional issues are often understated, and as one of the quotes I've seen earlier is a bit over-romanticised about close-knit communities and people fitting in. I've only recently moved back to the country after being in Melbourne for a very, very long time, and I would say there's quite a bit of truth to that. If you're an isolated person living in sorry, I won't say an isolated person. If you're a person that lives out of town and you have certain responsibilities with your children or with your parents, you're maybe the sandwich generation, life can get lonely. You can feel that you're doing a lot of tasks without a lot of connection. So what we work hard to do is to try to provide opportunities for people to connect in a way that best suits them. So we canvass people, we ask them how they want to meet, and conversation is one of the hugest things that comes up. I want to talk to somebody. I want to be in a room with somebody. I want to share a cup of tea. I want to work on this issue and make a big change. So WDV can only do that in collaboration with other organisations like Women's Health Loddon Mallee, like CASA CV, like Centre for Non-Violence. I'm giving Bendigo examples, but there's other examples across the state where we have relationships with other organisations as well.
It was great to be able to come in and drop in actually to the hub in Bendigo and to meet your team and get a perspective on how that felt. And coming in and just being able to share and building those relationships. So certainly encourage people that live locally or live locally to the other services to connect with the hubs, because it is a great platform to be able to go in and sort of bring an idea or get feedback. And it's a really, like you said, around partnership. We know that it can be really difficult to hear from women with disabilities sometimes. So being able to have access to your hub is a really great way of us to start that. But it would be great if you would be able to share with us what else can we do to make sure that women with disabilities experiences are heard.
Well, I guess the onus is also on WDV, making sure that women with disability are visible. So I think working alongside other organisations and not sidelining disability into the disability box on its own, so that it's sidelined and siloed and not talked about in the same context as other issues, which are, could be around lack of employment, lack of education, inability to travel because transport is limited. Keeping all of those topics aligned with disability being part of the mix at all times. I mean, 1 in 4 persons has a disability. That number is going to increase over time as we're an ageing population. Some of the members from in our regional hubs across Victoria have only acquired their disability at 79 or 81. So they're new to the idea of thinking about disability. So having intersectional hubs, meetings, opportunities where there's a range of groups, a diversity of disability visible in plain sight, makes it more meaningful for people to understand how we need to accommodate, how we need to make space, and how we need to make sure there is enough room for voices to be heard and to not just to listen, but to act and be practical with it.
That's really good insight for sharing.
I hope I'm answering your questions and I'm just not saying stuff that I like to say.
No, you absolutely are answering the question. Actually, somebody has just asked a question in the chat and said that your organisation sounds fantastic and they would like to connect with you, and what's the best way for them to do that. And I believe we have dropped Liz's contact details in the chat, and if not, they're coming right up. What's the best way for them to get in touch with you, Liz?
Probably email through my work email, which is liz.wright with a W at wdv.org.au. And I also have a mobile, which is 0429. Oh my God, what's the next bit? 0429. I'll put that in the chat.
We'll put it in the chat.
I never call myself, so. But WDV is an organisation like other organisations where we have the tension of having to look for funding, try to continue on with programming, because we know through all of this work, and getting back to the strategy, we know that if you did a 1-year strategy, you're not going to get anywhere. It's a slow burn. We need to work carefully and respectfully with each other. We also need to understand that sometimes we're as ableist about ourselves as other people are towards us, that there is thinking that comes when you grow up and when you acquire a disability that just doesn't go away overnight. So there is an element of our work which is about understanding who you are, understanding why you're not less than, and working with how you are in the community and making sure other people understand that. So, I mean, ableism is quite a complicated concept and way of thinking, but I do want to point out that we have it too sometimes, and we have to keep that in check and make sure that we are seen as proud, independent, autonomous people that have value and can contribute. And investing in people with disability, women and gender diverse people with disability, is an investment for the betterment of everybody.
Absolutely. I can't agree with you more. That's a fabulous reflection. Thank you so much, Liz. And thank you so much for your time today and for your insight. We do have some more questions for you in the Q&A, so stick around. But we are going to move to hear from the Mental Health Local. We have got Libby Pickles and Liz Davidson with us today. They are practitioners from the Mental Health and Wellbeing Local, a community-led mental health program dedicated to walking alongside people on their recovery journey. Drawing on lived experience and a commitment to person-led care, they're passionate about ensuring that everyone can access respectful and meaningful support. And their work aligns beautifully with Her Mental Health Matters priorities 3 and 4, focusing on reducing barriers to wellbeing and empowering individuals. Welcome, Libby and Liz.
Thank you so much for having us. I'm having a little bit of an imposter syndrome after the great speakers before me, but thank you so much. I feel privileged to be a part of this.
Wonderful. Over to you.
I do have slides, so I will share them quickly. Perfect. All right, good morning, everyone. My name is Libby. I am the lead practitioner for the Bendigo and Echuca Mental Health and Wellbeing Locals. I'm here representing with Liz Davidson, who is the acting team leader. So how did we come about? The Royal Commission found that people were struggling to access timely and appropriate mental health care, especially outside of hospital or crisis settings. That's where we, also referred to the locals, were created. We're designed to provide free, easy to access support close to home without needing a referral or a mental health care plan. We're a consortium partnership that offers clinical LGBTQI+ specific, Aboriginal and Torres Strait Islander, and alcohol and other drug support. Our work is peer-informed and peer-led, meaning a lived experience perspective underpins everything we do. We not only want to reduce pressure on emergency services, but we want to support people before they reach that crisis point and hopefully prevent it. Our model is peer-led, trauma-informed, and focused on reconnecting people back to their communities. Barriers women, girls, and gender-diverse people face. The Her Mental Health strategy more in-depthly highlights the unique barriers women, girls, and gender-diverse people face when seeking support. Here I've listed a few, but not included two. The stigma around mental health, a lack of trust in services, fear of losing custody of their children, no awareness as to what's available in the community, financial hardship that makes it hard. For those in regional areas, accessibility itself is such a major challenge, with distance, transport, and workforce shortages making it hard to access timely help. Family violence and caregiving responsibilities put a huge strain on mental health and can stop people from prioritising their own well-being. These barriers are exactly what Strategy Area 3 speak to, the need to break down the practical and systemic obstacles so care is safe, inclusive, and accessible. How we, the locals, address these barriers. First of all, our service is free with no wrong door. This means people can come in, and even if we are 26 plus, even if they are underage, we can still direct them to the services they need to get support. Anyone can walk in, call, or self-refer. We offer flexible options of support, including drop-in support, appointments, or telehealth, so support can fit around people's everyday lives and caring responsibilities. We have satellite sites in regional towns. So far, we have them running in Rochester, Heathcote, and Bort, with a few more underway. This reduces travel for those in those regional areas. There's no need for a mental health care plan, which we probably all know that takes away a massive hurdle. We focus on warm connections, not just referrals. Our service navigation is do with and not for, making sure people build confidence to manage their own pathways. My favourite part of this program is what we refer to as a pop-in and pop-out model. We understand that mental health is not linear, and people can pop in when they need a bit of extra support and then pop out, which is stepping back into community when things are going well. Knowing they can come back and get support whenever they need. There's no time frame on when they can re-engage. And importantly, our spaces are inclusive, safe, and trauma-informed. We want to support people to be able to self-manage, build confidence, which directly speaks to Area 4, which Liz will touch on. But our aim is to empower people with skills, knowledge, and resilience to protect their well-being throughout their lifespan. Liz will take over from here and talk a bit more about empowering women's choices.
Good morning, everyone. All right, just bear with me. I'm a bit technology challenged. Okay, here we go. Okay, so I'm obviously here with Livy to represent the Mental Health and Wellbeing program. So empowering individuals to protect and improve their well-being. So her mental health strategy says that women, girls, and gender diverse people have unique needs and experiences across different life domains and stages. Through opportunities to build their mental health knowledge and skills, they can more confidently navigate life's stresses and pressures, advocate for themselves, and actively shape their own well-being journey. At the Mental Health and Wellbeing Local, we empower women to take back their lives by providing them a space to feel heard and seen. We are person-led and focus on safety, confidentiality, and cultural respect. We walk alongside them with a nothing about us without us lens. We support them to build capacity to live stronger in the community. How have we done that so far? Well, we have a peer-led mothers group called Strength in Mothers, and it was developed in direct response to the growing needs of mothers in our community who are experiencing heightened rates of perinatal anxiety, depression, and social isolation and emotional fatigue. Many of these women engage with our services during highly vulnerable periods of their lives and benefit greatly from peer support, structured guidance, and opportunities for connection. The group is delivered fortnightly, and it has about 4 sessions during a school term that cover topics like perinatal mental health, depression, anxiety, OCD, stress and burnout in motherhood, guilt, self-care and identity, relationship dynamics and communication. And we hope to run similar psychoeducation groups covering other topics such as menopause, anxiety, depression and relationships with mental health in the future. Peer support and normalising challenges women face. The Mental Health and Wellbeing Local is a peer-led program that offers holistic support to enhance recovery and wellbeing. Peer support is the support given by our peer practitioners who have lived experience of mental health challenges and recovery. They use their personal experiences to support, guide and empower women who are going through similar struggles. Hearing Me Too moments from other women makes individuals feel less isolated in their struggles. When women talk openly about anxiety, depression, trauma, etc., and other challenges, it helps dismantle the idea that these issues are rare, shameful, or signs of weakness. Psychoeducation. As I mentioned earlier, we hope to run regular psychoeducation groups for women to promote connection and belonging in the areas that I mentioned before. Promoting self-determination and voice. We ask, what's important to you right now? We validate their feelings and perspectives. We use strength-based languages that highlights resilience and capability. We build trust and we reduce isolation. For education, we have access to local resources to support people to know what is available in the community. And as the saying goes, you educate a man, but you educate a woman and you educate a generation. We use a strengths-based approach, focusing on what they know about themselves, encouraging women to make decisions that align with their goals and their values, therefore giving them the confidence to make informed choices. Thank you.
Thank you both so much. I really resonated what you said, Libby, about the pop in and pop out support. And I think that kind of there was a question that came up in the chat around like the way that we do things around practices. And I think that when we think about health, we think, you know, in a workplace, for example, perhaps you get better from something, and then, you know, the pop in, pop out allows you to think that, you know, mental health is linear, and there's going to be sometimes that you're good and there's going to be sometimes you're not. And I think workplaces and communities are able to be a little bit less rigid in our thinking and have a bit more of that pop in, pop out in our thinking as a way of being able to respond to our own mental health, but also the mental health of those around us. Thank you both for and I think also what you were saying, Liz, around that strengths-based language and building trust, so important in terms of being able to reduce stigma and allowing people to have great and thoughtful conversations. So there's thank you for your presentations. I'm really excited for all of our panelists who are able to join us today. And we've got a few questions for everybody. So if Sarah and Liz could and Libby yourself, bring your cameras back on as our panel. Also, in regards to the local, Libby, it's actually been really great. I've been able to pop into the local, and it has been wonderful to see that real sense of welcome and community that's been built within that space. I'm very excited for there to be more locals in our region. So we're in the Q&A section, and we did get most of our questions through in advance, and we have been able to weave a few of those into our responses so far. However, I do have a question around our vision statement, and I'd like to position this question to all of our panellists. Our vision is for Her Mental Health Matters is for women, girls and gender diverse people in the Loddon Mallee region to be empowered to stay well and protect their mental health throughout their lives. So this is a 3-year strategy. If we were going to jump forward 3 years, what does success of this look like for women's mental health in our region? And I'm going to position that one to Sarah first.
Thanks, Alison. Being a natural pessimist, I had a good think about this question. And my first thought was the one that comes across all the time, which is how do you measure prevention? It's a really hard thing to do. So after thinking about it a lot, I came up with that the stories that we're hearing through our networks and our communities is stories of folks accessing care that they need, that they're feeling safer, and more connected to their communities and more celebrated. And that would be all from all of particularly like our priority communities. So hearing that trans women are feeling safe, feeling that gender diverse people are feeling comfortable to walk through, say, Rochester wearing sparkly nail polish, for example, feeling confident to be who they are in our community. That's, yeah.
That sounds great. I'm into that. And I'm going to pass that. I think, it's what a beautiful, how beautiful that would be. I'm going to pass that to you, Liz.
Sarah, I'm the opposite of you. I am an optimist, but I'm also a realist. So in 3 years' time, what I would love to see is that when people present and want to express that they don't feel great, that they are really struggling, that people aren't saying to them, you need to do A, B, C, D. The question is, how can I support you? What would help right now? How can I assist you? And how can I place myself in the role of supporting someone rather than having a prescriptive way of offering assistance that is standardised, which we see a lot in our health systems, that things are standardised. I loved the pop-in, pop-out example earlier on because it isn't a linear journey for a lot of people, whether it's a psychosocial disability or another disability. So I'd like to see us responding in a different way. And I'd also like to see visibility and leadership in our organisations so that as a collective group, and I'm going to say primarily women and gender diverse people in this whole sector, that we have a stronger voice and that we can knock down the door at government houses and get more money, get more security, make sure that we're not always on this knife edge of, oh, what's going to happen? I'd like to see that tension removed, and I'd like to see people feeling that they can be truly themselves. And I do want to say that I didn't become very disability friendly till I was maybe 35. I lived a life where I was masking, working 10 times harder because I couldn't see things. And then all of a sudden, I don't know what clicked in my head, was I just thought, I can't do this anymore. It's exhausting. So somehow or another, I started asserting myself and then wanting that for other people as well, that we don't have to be in a situation where we're doing homework because there's no amenity in our workplace or at our children's schools where we can participate in fully and engaged as everybody else. So, optimistically, I think as a collective we stand a really good chance of making some real change in people's lives and our own.
Great response, Liz. So we've had a self-proclaimed pessimist, a optimistic realist. Libby, how would you position yourself to answer this question?
I'm a mixture of both, but I really love what Sarah said. And on the topic of what Liz said, in the future, I would like to see the less of full-time work, the work-life balance, minimising for the people in the fields. But I also want to see, before COVID, there were self-sufficient groups, people going out and catching up and making those connections themselves without us having to facilitate that. And one of the things I love about the local community groups is that they have formed those connections and gone out and continue them. They go on walks by themselves. They go get coffee once a week. That, to me, would be amazing to see.
So you're thinking in terms of we go back to pre-COVID life where people feel a little bit more empowered to make those connections and build those connections for themselves and are able to do that.
I feel like, yeah. I feel like we've kind of lost the ability to socialize and create connections because we were just in our houses for so long and didn't have to.
Yeah, and the ongoing impacts of that really still coming to light, I guess, in terms of the impacts on all of our mental health and wellbeing. I think it's a really good reflection. And I was thinking about what you were saying at first in your response, Sarah, around when we're working in health promotion and it's a time thing. Like you don't always get to see results immediately, but and I liked what Liz said around making strategies that go for a few years so that you can start to see and implement results. And I am an optimist, and I do feel like we live in a time of change, and I would love to see that for our strategy to contribute towards your vision of this strategy coming to life. I have another question. Of course I do. My second question is Sarah, and that is around if you could advocate, not if you can advocate, because I know that you do advocate, but if you could advocate for just one policy or system change that would improve or protect the mental health of women, girls, trans and gender diverse people in the Loddon Mallee region, what would it be and why?
Again, a difficult question. And I, as a neurodivergent person, I immediately went to the systems of getting diagnosed and all of that mess, which if you know anyone who sits in the neurodivergent space, you know how difficult that is. And then from there, did the journey on to accessibility. And where I ended up was that we need to be looking at how we can make all spaces accessible for all people. So, like those, it's one of my bugbears, those plain language documents that they put on the bottoms of like web pages after you read all the complicated language. Like, why don't we just write everything plain language?
Agreed.
And yeah, and like accessing spaces, and it's like, oh, here's the wheelchair access, which is harder to get to, versus here's the front door access, which has stairs. Why don't we just make everything with ramps? And for example, like why don't we just make conversations happen and meetings happen in a way that fits with people with ADHD? And why don't we have like fidgets everywhere so that people who need those spaces can access them? Yeah, accessibility is my thing. And like even like little tiny things that we can do to make meetings more engaging, to make spaces more accessible, to make information easier to understand and to read and to access, like all of that. I don't even know how to put that all into one, but that's a big soup that I've just thrown at you.
We're certainly getting a little love from the chat in response to this. So I think this is something that very much resonates with everybody. Make everything accessible always, I think, is the policy that you're looking for. Does anyone else have a comment that they wanted to add on to the end of Sarah's comment there?
Yeah, I do. I really, one of my bugbears is, Sarah, I cannot agree with you any more than 159,000%. I think this siloing is the thing that is continuing the myth that people with disabilities and people who have mental health issues or neurodivergent don't belong, and it's marginalising. So I fight back when someone says to me, look, we could we could have a hub and we could put it in a disability service. I'm like, no, I don't want to do that. I want to put it in the library. I want to put it in a community centre. I want to put it in a neighbourhood house. I want it in local government. I don't want to be in a disability service. I'm not anti-disability services, but I think a group of really interesting, robust women and gender diverse people having conversations around a table in a glass room in a library is of interest. And when people see people who have all different needs in interacting in normal environments, and I say normal because we know that access is not the norm, it is less than, that's when we can create cultural attitudinal change. That's when we can see people going, oh, they're all here doing this in this space, rather than like behind these doors of completely accessible buildings. Yes, that's great, but why wouldn't being in public spaces encourage public spaces to be better?
Great response, Liz. I think that certainly resonates with us in our embedding mental health into community settings and making sure it's visible and supported. Yeah, that's a great response. My next question is for you, Libby. You spoke to in your last comment around COVID and how it's made things are really difficult to connect. We certainly heard from everybody that influenced in the strategy that it is really difficult to connect across the life stages, rurality bringing additional challenges. So what tips do you reckon you can give us in terms of how we can help develop and maintain connections to help people thrive so that we can get back to that pre-COVID way, or support people that might not be their jam naturally in terms of feeling easy to connect?
No, I think one thing is having the consortium partnership. So something I value so much is the diverse knowledge and resources we bring together. We all have such different areas of expertise in the field, and the fact we can bring it all together and just provide that instead of handballing people to another service. Oh, they might know, but we don't know if they know. Also, my last role before I stepped into leadership was, as you mentioned earlier, a social prescribing role, a LifeLinks designated peer practitioner, which had that model of do with, not for. So that person could go alongside someone for their first time accessing a group just to build up that confidence so they can go again. That person could sit there while the person made the phone call and support them through it, just to be that body double. Social prescribing is a massive thing we were lacking here in Bendigo. I know Echuca has it in the library, but it just needs to be out there. The knowledge and resources for the community to have one point of access for that. Amazing.
Yeah. Fabulous. Thank you, Libby. Does anyone else want to jump on the end of that comment, or should I move on to the next question? Carry on? Yeah. Right. Liz, this one for you. Liz Wright,
yes.
Conscious of all the Liz's. Under our priority 3 in the strategy, we identify that people need to be able to locate and access inclusive and gender responsive mental health support when they need it. Can you share any examples of mental health promotion initiatives that run across the Loddon Mallee that are inclusive and accessible that can guide us?
I would say I'm not an expert on being able to give really good examples around that, but I see when people use social media or when people produce documents that are in easy read, that are heavily edited to be around what the topic is, rather than a lot of busyness around it, that appeals to a lot of people. So I would say, who do I think is doing mental health really well? Well, obviously, I think, Women's Health Loddon Mallee is. I think this strategy is really, I think it's a really great strategy, and I think it covers off on those things I was saying around, like, talking directly, talking in a distinctive way that is not too busy, but also looking at solution-focused responses to what stakeholders and what participants who have been surveyed have talked about. is really good. So you probably need to ask someone else who's deeper in the sector than I am what they think are good examples.
I think you've given us some pretty good examples so far across the chats that we've had today. I liked that what you were saying, Libby, about social prescription as that being an example of really of inclusive and accessible initiatives, and absolutely agree that we need to see more of that. And it would be also wonderful to see a place where you don't have to go to social prescription. You can just find that information itself. So getting that information into our eyes so that anyone can find out what's in their town. That definitely was something that came through from the research that we did, that people didn't realise how much was going on in their town. I think, Sarah, you had some great examples of some of those programs as well. Do you have another program that you'd like to share?
Oh, this is the one that everybody knows that I will harp on about forever. Thorn Harbour Country in Bendigo does cuppas every month. They also do them up in Echuca. They've just started some in, I think it's Gagari, maybe. It is a beautiful space, not just for LGBT folks, but I go pretty much every month because it's something that makes me feel better and connected to my own community. I don't know, it's kind of general knowledge, I feel like, but if you're LGBT, it's almost guaranteed that you're probably also going to be neurodivergent, and you're going to be sitting in all of these different spaces. So it's like they're your people. It's such a beautiful space to come to, and I see the same faces every month, but also new faces, and it's an amazing program that is ongoing, and it definitely creates more community connections and more social networks out of that. I've made multiple friends there.
That's lovely. That's great. And it's the Thorn Harbour Cuppas are a great point to catch up to. And Corinne, our wonderful, is doing some wonderful tech in the background and has just dropped the link to Thorn Harbour in the chat. There's been some really gorgeous feedback in the chat for all of our speakers. So thanks everybody that has contributed. We have as a final thing today, I do have a closing summary, but I'd love everyone to be thinking, when we're talking about mental health and wellbeing, and we're empowering ourselves to look after our own mental health and wellbeing, as well as the systems to better look after all of our mental health and wellbeing. So as I do my closing summary, have a little bit of a think about what you might be doing after this session to look after your very important mental health and wellbeing for yourself. I have a beautiful wattle outside my window and it is beaming at me. So I shall be getting out into nature following the close of the presentation. So have a little think about what you might be doing. Have you got a couple of words about what you might do after this session for you, Sarah?
I have my little teenage cat that is demanding attention, so that is probably what's going to be happening. And also my supervisor really wants to catch me to do some planning, so I guess I'll be doing both at once.
And what about you, Liz Wright?
Well, I have planted bulbs for the first time in this house. I've been in this house for 5 years and they've all started to come out, so I'll have a squiz at them. I'm going to marinate something for dinner, and there was a movie suggestion earlier before we started this presentation that I will make sure I download for later on.
Fabulous. And how about you, Libby? How are you going to look after yourself after this presentation?
I am also going to go take advantage of the sun and stretch my legs after sitting down for so long, and maybe grab some lunch.
Wonderful. So everybody that's tuning in, if you'd like to join us in this reflection about what you might do to look after your health and wellbeing following. But I would like to thank everybody that has attended today, our wonderful presenters and panelists and our incredible Auslan interpreters who've done a great job of keeping up with us. Apologies for the many, many words, but you've done a wonderful job. As you heard today, our 5 priorities for action are to improve the mental health and wellbeing for women, girls, trans and gender diverse people across our region, are enhancing local evidence, strengthening community connections, addressing barriers to support, and empowering women to improve and protect their wellbeing, and embedding mental health in community settings. This strategy is just the beginning. It is a framework for collective action, one that we'll activate in partnership with you, our community, our local government areas, community houses, service providers and advocates across the region. Together, we are creating environments that support mental wellbeing, environments that challenge stigma and ensure that every woman, girl and gender diverse person is seen, heard and supported. But before I finish, as any good health promotion officer knows, evaluation is the key to success. And it would be very helpful if you could scan the QR code and share your thoughts on this session. It'll only take a minute or two. If you feel that there's something that we have missed or there is something that you'd like to revisit in this session, the session has been recorded and will be available on our website ongoing. Thank you everybody for your time and commitment to improving the mental health and wellbeing of women, girls, trans and gender diverse people across our region. And on behalf of everyone at Women's Health Loddon Mallee, we look forward to continuing our work with you together.